Welcome. I'm Tim Lazert, Director of the Orlando VA Medical Center. Now that you have transitioned from active duty, we welcome you as a patient. The staff and volunteers of this medical center thank you for your service, dedication, and sacrifice to defending this great nation of ours. We are pleased you have selected us to provide your health care. On behalf of the Orlando VA Medical Center, I thank you for taking the time to watch over this video presentation that will help you guide you to a healthier lifestyle. We take your health care seriously. We believe in the mission of the Orlando VA Medical Center to honor America's veterans by providing excellent health care that improves their health and well-being. Our vision is to be a patient-centered, integrated healthcare organization for veterans providing excellent health care, research, and education. An organization where people choose to work, an active community partner, and a backup for national emergencies. Thank you, and again, welcome to our medical center, the Orlando VA Medical Center.
Welcome to this interactive video presentation that introduces you to the Orlando VA Medical Center. Hello, I'm Dr. Jackie Renner, your host for this introduction. We will be providing you our new Veteran Orientation, also known as NVO, for you to get to know your VA. As you enroll into the Orlando healthcare system, you will receive accurate and up-to-date phone numbers for easy contact with the services needed and much more. It is our honor, as well as our mission, to provide you with professional health care in a timely manner using state-of-the-art technologies and services. You are the reason we're here, so please do not hesitate to provide us feedback that will help increase the quality and timeliness of your care. Our goal is to be the organization you think of first for excellence in VA healthcare. We are here to serve you. Most veterans may be required to take an annual means test. This is a measure of your family's income and assets. It will also determine whether or not you will be charged a copay to the VA for medication and services you receive. So how do you determine if you are eligible for care within the VA? In order to meet the eligibility requirements, you must not have been discharged dishonorably. Also, you must have served a minimum of 24 months if you entered after September 7, 1980 as enlisted, or after October 16, 1981 as an officer, or if you're a National Guardsman or reservist and you were called to active duty by presidential order and served the entire period, not just for training purposes. Our eligibility staff at Lake Nona is located on the first floor near the front main entrance. Their hours of operation are 7:30 in the morning to 4:30 in the evening. Please contact the other Orlando VA facilities for their hours of operation. If you meet the eligibility requirements, the VA charges co-payments for some non-service connected treatments or conditions. Congress sets these co-payments amounts annually. You will hear the terms service-connected, or SC, and non-service-connected, or NSC, that are used frequently in the VA. Service-connected means that during your active duty service, you acquired an active disease, injury, and mental or physical condition, and upon discharge from the military, you filed a claim on this condition, and it was approved as a disability. Non-service-connected means you have a non-service-connected condition. If you have questions about your veteran service-connected or non-service-connected status and how it relates to co-payments, contact one of our enrollment clerks. By law, the VA is responsible for billing third-party health insurance carriers for treatment provided to you for non-service-connected conditions. Please keep us updated to changes in your private insurance carrier and coverage. For information, call a billing representative. To better serve you, the Orlando VA healthcare system has 9 facilities that are strategically located throughout Central Florida. So no matter if you live as far northeast as Daytona Beach or you live in Kissimmee or Viera, you'll have a first-rate medical care facility close to home. There are 3 large outpatient clinics, also known as OPCs, and 4 medium-sized community-based outpatient clinics, or CBOCs, to serve your needs. Please keep in mind, regarding your healthcare needs, not every facility has the same services available, and you may need to travel to one of the other facilities, or perhaps go to a contracted community care facility, depending on the care you need. For more information regarding the other facilities within the Orlando VA network, please click on the facility links provided on this flash drive. The main facility of the Orlando VA healthcare system is now located in the Lake Nona area off of Highway 417, southeast of the Orlando International Airport. With the latest in medical technology and services, the hospital includes inpatient and outpatient services, a 24-hour emergency room, a state-of-the-art community living center, domiciliary, and chapel with more than 2,500 parking spaces. The Orlando VA Medical Center is changing the way of providing healthcare to you, the veteran. Evidence shows that there are better outcomes when we start making lifestyle changes to promote and maintain optimal health. In other words, preventative medicine. Our goal is to not only treat your existing health conditions, but also to provide you the information to help prevent other health concerns. We will work in partnership with you to meet your needs. After your first visit, your provider will recommend a time frame for follow-up. You will receive a reminder for your appointment date and time. So you don't miss out on your next visit, please keep us up to date with any changes to your address or phone numbers. Missed appointments can be considered as a no-show. In addition, missed appointments will not be automatically rescheduled. You are responsible to reschedule if you cancel an appointment or if you arrive late after your appointment time. Please take into consideration travel time to get to any of the clinics. If you need to cancel, please contact the scheduled clinic 48 hours prior to your appointment. This will allow us to contact another fellow veteran to use the appointment time. The VA has launched a primary care medical model called PACT, or Patient Aligned Care Team. Here, the patient, family members, and caregivers actively participate in the healthcare process. The expectation is that as an active participant in your care, you provide your PACT team accurate and complete information about your current health problems, past illnesses, and hospitalizations, your concerns about your health and matters related to your health, your medicines, including over-the-counter medicines and herbals, as well as your medication list. Also, you can help us by planning ahead by writing down questions or concerns you have and raising them with your provider. Other important points for your quality of life include sharing your beliefs about your health problems and your treatment, sharing your preferences for treatment options, asking questions about anything that's not clear to you, and asking for written information and instructions. Showing up 20 minutes before your appointment time is greatly appreciated. The VA believes each veteran should have one single primary care provider. However, the VA recognizes that some patients may choose to see both VA and non-VA healthcare providers. The VA calls this shared care. You may have an urgent need for local hospitalization and there is no VA hospital nearby. Yet, your outside provider will be able to manage your care at the local hospital. The VA provider would not. Or, you may have developed a relationship with a specialty or primary provider you would like to keep. We encourage you to do so. In an effort to keep you safe, the VA created national rules and regulations for shared care. These rules and regulations support high-quality health care and ensure compliance with state and federal regulations. In order to receive medicines or healthcare services at the VA, your care must be managed by a VA primary care provider. The VA provider has the final responsibility and authority for decisions regarding treatment that the VA provides. A VA provider is under no obligation to follow a treatment plan recommended by a non-VA provider. Certain medicines require careful monitoring, for example, blood thinners or antibiotics. For your safety, the VA will not provide high-risk medicines unless you are willing to come to the VA for the necessary lab testing, monitoring, and management. On every clinic visit, please arrive 20 minutes earlier than your scheduled appointment. You must check in with the clerk or the self-check-in kiosks where available. This notifies the team that you are here for your appointment. If you happen to have an upper respiratory infection and come to the clinic, please ask a staff member for a mask. There are several ways to obtain an appointment with your healthcare team. Directly with the HOS clerk after seeing your provider and he recommends a follow-up visit, using secure messaging through My Healthevet, more on My Healthevet later, calling Telecare at 407-629-1404, or as a walk-in. However, we strongly encourage you to use the first three options. As a walk-in, you might have to wait for several hours until the provider can evaluate you. We know your time is valuable and would like for you to take advantage of the many ways you can make an appointment. There are important things we must do before you see your provider. During the intake process today, you will be given forms to fill out that give us important details regarding your medical history and condition. It is very important that you fill out these forms and bring them with you to your initial primary care provider visit. Your new patient visit is usually a more intensive appointment with your primary provider, expected to last a little longer than your next visits. A nurse will do the initial screening, obtain vital signs, weight, and when needed, provide preventative health education. It is important that on your first visit with your provider you bring your veteran ID card, outside health insurance cards, any recent non-VA medical records, as well as the actual bottles of your medicines, including medication reconciliation keeps you safe. Ensuring that your medication list is up to date is one of your responsibilities. Your collaboration helps keep you and other providers informed of your current medications. Whenever you check in for an appointment, the clerk will give you a printout of your medication list. It will first list the VA medications with the name of the medication, dose, and how often to take it. Then it will list the non-VA medications, over-the-counters, and meds from outside pharmacies that you have told us about. We want to partner with you in your healthcare. Please do not leave the clinic if you do not understand your treatment plan, and make sure to have all your questions answered to your satisfaction. A good way to ensure you get the answers you need, consider using the 3 most important questions. What is my problem? What do I need to do? Why is it important for me to do this? Repeat what the provider says out loud in your own words to make sure you understand. Keep the conversation on track. Stay focused on what matters to you. Let the provider know if you don't understand what he or she is saying. Don't leave without understanding what has been said to you and what you need to do to be as healthy as possible. The Orlando VA Medical Center wants to keep you healthy. Take advantage of getting the recommended screening tests. Those tests include screenings for prostate, cervical, breast cancer, colorectal, and hepatitis C for high-risk patients. We also provide immunizations for flu and pneumonia, as well as treatment program information and other preventative health information. Your provider will request a set of labs to create a baseline after your initial visit. Please check with your local facility for their hours of operation. Most laboratory tests do not require the patient to be fasting. If your provider notifies you that you have fasting tests ordered, you will be required to fast, meaning nothing but water, for 12 hours prior to your appointment. Be sure to continue to take your medicines unless instructed otherwise by your provider. If you take insulin or pills for diabetes, bring them with you to the clinic so that you can take them after the lab is drawn and you are ready to eat breakfast. Please be sure to bring your VA ID card for all lab appointments. Veterans are not generally contacted to discuss normal lab results. Your provider will discuss results of lab tests with you at your follow-up appointment. If there is an abnormal finding from a lab or diagnostic test, you will be contacted earlier, another reason to keep all of your contact information up to date. Now that you have done your initial visit, you may be scheduled for other services or testing needs. Specialty services within the Orlando VA Medical Center include orthopedics, urology, podiatry, respiratory therapy, endocrinology, women's health and GYN, dietitian and nutrition, dental, pharmacy, psychiatry and psychology, mental health, substance abuse, homeless outreach, radiology, social work, audiology, eye clinic, physical therapy, occupational therapy, recreational therapy, and prosthetics. For radiology, please follow the prep instructions that were given to you. If you have questions, need to cancel, or reschedule the appointment, call Telecare. Your provider will notify you if your results are abnormal. Otherwise, results will be discussed at your next visit. In order to be eligible for dental services within the VA, you must fall under one of the following categories: be service-connected 100%, service-connected for a dental condition, discharged within the past 180 days and no dental care 90 days prior to separation, former POW for 180 days or more, dental condition aggravating a service condition and/or vocational rehabilitation, medical need, or a homeless veteran in transitional housing for at least 60 days. If your provider has prescribed medications, you will need to go to the pharmacy. Your prescriptions will only be filled from an approved list of medications called a formulary. The formulary allows us to provide optimal care to veterans and includes medications from all drug classes. Your non-VA prescriptions may have to be changed to a medication on the VA formulary. Keep in mind that your VA provider may only write prescriptions for conditions that they are managing. It is important to maintain your care with your non-VA provider until your initial VA appointment. To fill new prescriptions, your VA provider enters your prescription in the electronic medical record and will indicate whether the prescription will be picked up or mailed. The order will then go to the pharmacy. If you need to pick up your medicine immediately, you may pick it up the same day at our pharmacy. When your medicine is ready, your name will appear on the electronic board located in the designated areas. You will need a picture ID, preferably your VA ID card, to pick up your medication. If you do not pick up your medication or the provider orders the medication for mail, your medicine will be delivered by mail to your address on file. Please allow 7 days for your prescriptions to be delivered to your home. If you are completely out of medicine and do not have any refills or upcoming appointments, you can call Telecare or use the phone number on your prescription label to call the automated system to request additional refills from your provider. The fastest method to refill your prescriptions are by phone at 1-877-646-4550 or by the internet through the My Healthevet website at www.myhealth.va.gov. You must register to access this program, but once registered, you can check the status of your refills and view or track your entire prescription history 24 hours per day, 7 days per week. If you are at the VA, you may also place your refill slips in the pharmacy drop-off box in the pharmacy area. Now that you're enrolled in the VA and you have been seen by your provider, there may be secondary services that you will need to use. If you're having difficulty resolving issues or have concerns or questions, you can contact the patient advocate in the building. The patient advocate is a link between you and the clinic healthcare team. This individual will ensure that your issues and concerns are addressed by the appropriate staff and will advocate issues on your behalf. The VA may provide specialized mode travel, which is transportation for disabled veterans with clinic appointments. This will only be authorized at the VA's expense if a VA provider has determined and documented that special transportation is medically necessary because you are not able to travel by public transport. Health information is provided for veterans and families. In addition to the information and education you receive by your primary care team, we offer a wide variety of health education classes to veterans and their families. Ask a member of your primary care team to enroll you in one of the several classes that we currently offer. Those classes include smoking cessation, diabetes, weight loss, mental health, caregiver support group, and high blood pressure, to name a few. Our diabetes program has been recognized at a national level, and our MOVE program has seen an average of over 2,000 pounds of weight loss annually. It may be worthwhile to check it out. Community health nurses and social workers ensure necessary care is delivered through community agencies. The following services are available if you are eligible: home care, hospice, nursing home placement, homemaker aid program, and private hospitalization through the ECF program. If you are interested in any of these programs, you may discuss your needs with your provider. Some patients are eligible for travel reimbursement. You must meet one of the following. You are being seen for service-connected conditions. You are greater than 30% service-connected. You are on a VA pension. You are being seen for a CMP exam, and if you qualify, you will sign a voucher. To obtain copies of your VA medical record, you must go to Release of Information, or ROI, and sign a form. This process is required for release to anyone other than the veteran, including family members, partners, and significant others. Some notes may not be available at the time of request, so they may be mailed. You can also obtain part of your records by using My Healthevet. If you are not a registered user of My Healthevet, you can request a copy of your records using the self-checking kiosks where available. Another benefit to the Orlando VA Medical Center patients is access to Telecare. Telecare is a 24-hour, 7 days a week live patient information telephone line that will assist you with healthcare questions and concerns. With Telecare, you can speak to a clerk to schedule, cancel, or reschedule your appointments. A pharmacy technician is available to speak to so that you can request renewals of your medications. You can also speak to a registered nurse for advice on health problems or get a message to your provider. Using this resource may save you a trip to the clinic. However, keep in mind that Telecare is not for emergencies. Call 911 if you have a medical emergency. In the case of a medical emergency visit to a non-VA ER, you are responsible to call us within 48 hours so that we can update your records. If you were admitted to a non-VA hospital, you are responsible to call us within 72 hours. Bring a summary of your admission, treatment plan, discharge, and medicines to your next primary care visit. Not all ER visits are paid for by the VA, and payment decisions will be based upon your service-connected ratings and your conditions and diagnosis. To avoid delays in payment or other hassles, please contact us within the previously identified guidelines of 48 hours or 72 hours. VA services are a benefit, not health insurance. Make an informed decision before you cancel your private health insurance. Another free resource you can take advantage of is My Healthevet. Although this website is open to every veteran, you must be registered. To access My Healthevet, please go to www.myhealth.va.gov. As a registered user, you will be able to request refills online, keep track of your appointments, communicate with your healthcare team, and even enter and track personal health information. Once you've registered to My Healthevet, you can learn about your health, treatment options, and what you can do to stay in the best shape possible. You also have access to the Veterans Health Library, a resource designed for all veterans. You can also access links to federal and VA benefits, view wellness reminders, or clinical reminders. Social Work Services is a department that assists our veterans and their families in coping with resolving emotional, social, and financial problems. You do not have to battle these alone. Let the social worker at your PAC team assist you with some of these issues. Advanced Directives is a document that allows you to give directions about your future medical care. This document could be a living will or treatment preferences, durable power of attorney for health care, otherwise known as a healthcare proxy. It is your right to accept or refuse medical care. Advanced Directives can protect this right if you ever become mentally or physically unable to choose or communicate your wishes due to an injury or illness. To get more information regarding Advanced Directives or other services in the social work department, please make an appointment with your team social worker. Here at the Orlando VA, we have a transition and care management team ready to welcome post-9/11 veterans and help coordinate their care. For veterans that were deployed during the OEF, OIF, OND campaigns, a transition patient advocate or TPA will advocate for you as you move throughout the VA healthcare system, acting as your case manager. Your TPA will coordinate patient care activities. If you are seeking mental health services, keep in mind, it takes the courage and strength of a warrior to ask for help. If you are in an emotional crisis and having thoughts of hurting yourself, we are here to help you. For immediate action, you can call 1-800-273-TALK and press 1 for veterans. Help is available 24/7. We care and will be on the other side of the line to help you. Our staff can also help you schedule an appointment to see a provider in the mental health department. Information can also be found at www.suicidepreventionlifeline.org. A one-on-one chatting service for veterans, families, and friends is available. This is an anonymous service with trained counselors available from 4 p.m. to 11 p.m. The service is not intended for a crisis response. Another available resource is the use of vet centers or veteran centers. Vet centers provide community-based counseling, outreach, and referral services to veterans who served in any combat zone and their families. Services include counseling for transitioning and readjustment, military sexual trauma, and issues related to marriage, family, and bereavement. Referrals to VA mental health care, employment, education, and other services and benefits are also provided. On behalf of the Orlando VA Medical Center, thank you for taking the time to watch this video presentation that will help guide you to a healthier lifestyle.